Well, welcome to the 1760 sessions, where we talk to founders, building systems and impact. I'm Harry, as you all know, from 1760, and today I'm joined by Trey Williams, founder of the Peds MD. Trey walked away from what he calls the meat grinder of corporate medicine to build a concierge pediatric practice in Charlotte. The house calls, round the clock access, the same doctor every time. Really amazing what he's building. And it started with just 5 mums who tracked him down and essentially wouldn't let him go. So Trey, thank you so much for being here.
Yeah, happy to be here. Thank you.
Okay, probably a conversation for another time, but I've just learned that Trey is a lifelong, well, since 2007, a big two fan, but it's for another podcast about football. So where I wanted to start with is
Yeah,
what led you to start the Peds MD?
yeah, it's like most founder stories of wild, and you think back. I reflect all the time on how I ended up doing this, and it is really strange, and mostly driven by those moms that you mentioned that kind of chased me down on various platforms, Instagram. Getting LinkedIn in mail from an old patient was an interesting way to be reached out to, but
Yeah.
I'd already actually left corporate medicine to go work for a health tech startup, really not seeing patients, and realized I was really missing that like relationship piece. And I knew I missed primary care, but also knew I didn't want to go back to corporate healthcare, like the meat grinder, right? Seeing 20 to 30 kids a day for any doctor is exhausting,
Yeah.
and very emotionally taxing, right? And so the that mixed with these moms who reached out and were asking for care, I just started to think like, hey, I can offer this for my own family, right? I offer this, it informally for my friends. Like, could this be something parents may actually pay for? And so I pitched it to these 5 moms more as a joke. And long story short, that was the beginning, the genesis of Peds MD, and the model that we've created, and it's definitely just morphed and grown over time. Always kind of falling back on those original moms to help me guide me to
Yeah.
build something that's useful for them. So very weird, circuitous
It's
story.
it may sound weird, but it sounds amazing from the pen where you've seen a problem with the healthcare system as it is, and you pivoted to offer something that's better quality for those people you're actually serving. And, we joked around calling corporate pediatrics the meat grinder. So what I'd love to learn is what did that sort of normal day in that world actually look like day to day, really?
Yeah. I think the day to day. A, they're really long. B, especially when you have kids. I have 2 small kids. You're dropping them off first thing in the morning, as soon as school opens, 7:45. I'm rushing to clinic to jump right into patient care, anywhere from 20 to 30 kids a day. I was on a 20-minute appointment schedule, and so I had 20 minutes per appointment, which meant I really had about 10 to 15 minutes actually with my families in the room,
Wow.
which for some cases can work, right? If you just have ear pain, quick appointment, right? That's very easy. But a brand new baby, like how do you equate the two? Like first time parents, right? 10 to 15 minutes is definitely not enough time to cover all their concerns or be proactive. And I think that's the key term here is, the corporate healthcare is just very reactive, right? Like if you have a problem, come seek me out, right? Not, hey, let me reach out to you. Let me support your child through this illness by following up with you. Because you just can't do that. You don't have time. How you're making these hospitals and these systems of money is by seeing patients, right? Being busy. And so, you'd be cramming in just kids. I'd have a schedule that may look light for a day, like maybe 22 kids, but I'd have parents messaging in saying their kid's ear hurts and want to be seen. And so we fit them in. We call it double booking. And so you end up at the end of the day seeing 30 kids. So you're seeing kids from 8 to, 4:30 p.m. Then you're working on notes home at maybe 5:30.
Yeah.
And again, with kids straight into kind of the dinner bedtime routine, and you just do it all over again. And, it's not good for families. They're not getting the time they need to get their questions answered, to like talk about, prepare them for things that are going on or going to come around the corner. But also for the providers too, it's just really hard, and it's very easy to get burned out in that type of system.
Yeah, and it's not good for your own mental health, just hearing about it.
Mm-mm. Yeah, you're
And
right.
I had no idea that these sessions were only 15 minutes long. And I can just imagine you're probably in this sort of situation where you haven't answered all of the questions in their 15 minutes. And you probably have to stay a bit later, which creates a complete knock-on effect to your entire day.
It
Of
does.
Was
Yeah.
that often the case?
It is, and, you know, you wanna spend time with your families, and I felt like I was pretty good at making my families feel like I wasn't rushing. But you know in the back of your mind, like, as they're talking to you, you're thinking about, the morning block, right? I have 8 more patients after you. I can't really spend another, 10 or 15 extra
Yeah.
minutes with you talking through these things. I would love to do that. Like, most providers would love to do that, but they know they can't because, "Okay, now I'm behind. I know my lunch hour is completely gone," right? I'm gonna be either seeing patients kinda into lunch and then have a shorter lunch, or I'm gonna answer messages during lunch and not really have that time. Right, so just you're right, that knock-on effect is real throughout the entire day, and over time, it does just, grind you down and, makes it hard to be curious and to, again, really make sure you're answering all these patients' questions. A lot of
Exactly.
times I will tell parents, "Send me a message, and I'll answer the questions," and through, like, the electronic portal that we have. I'll try to answer those at some point in the next week, and then inevitably, you just run out of time or so anyways, yeah, it's tough.
Taxing. So you spoke to me about a phrase last time we had a call when you spoke about this, this adaptive primary care. What does that mean in practice, and what's the bigger mission behind it?
Yeah, it's a great question. I think it took a long time to try to figure out what we wanted to call this because we knew it was just a very different type of model of care than obviously what traditional medicine offers, but even what a lot of concierge, which is a very vague term, can mean a lot of different things, but a lot of like concierge practices offer. And so, kind of in my mind, kind of going back to like, hey, these moms are reaching out to me. What happens if my own kids are sick? What happens if my good friends' kids are sick, right? They can reach out to me, or I can go to their house and see them, or I can meet them somewhere and see them in a car, right, for a quick ear check. And so I just kept asking myself, like, why does corporate healthcare, why does current healthcare really force families to adapt to us? Like, come to our location, come during
Yeah.
our office hours, come during certain scheduled appointments, right? It's very like you have to come to our four walls. Like you come to us when healthcare, if you really boil it down, is another service industry, right? We're providing a service to people, and what's winning these days is service that really adapts to our families, right? So what
Yeah.
that looks like in practice, there's a few pillars we talk about with adaptive primary care we've kind of designed, but one of the biggest things is that we adapt to you. We want healthcare to operate within the rhythm of your life, not within our lives, because
Yeah.
if you're a parent, kids get sick in the evenings, kids get sick on the weekends. And oftentimes it's not something serious, but parents just want some reassurance, especially first time parents, that everything's okay or what do I need to look out for, right? It's like very simple things. But again, most offices are closed or, expect you to come to them. And guess what? My schedule's full. So you have to see a different provider. So we really emphasize that adaptability around our parents' lives instead of the other way around.
And I love it. So there's such a big gap in terms of relationship and value that they'd be getting. And it's amazing to see that you're trying to sort of plug this with Peds MD and
Hmm.
picture every parent, their essentially their babies and their child is everything to them, and then to have to work around an office schedule is just it's probably a nightmare. Well, it is a nightmare.
Yeah, it is. It is. And a lot of my families, both parents work. And I can tell you this one story that I think really, really hits home. But I had two parents, they work in banking, very busy. We'd been following this child because he'd been having ear pain and, cold symptoms and stuff, which obviously concerning for like an ear infection. And mom called me or texted me one morning. She was already at work. They had a full-time nanny and was like, hey, he's no better. We texted her actually. We check in with our families when they're sick. We texted her, hey, how's he doing this morning? And she reported, not good. He's like a little worse today, but nanny's got him at the park trying to cheer him up. And I had seen him yet at this point. And so I said, well, give me the nanny's information, right? Let me like
Yeah.
coordinate with her. If you're comfortable, I can go see him wherever they are, right? And they were at a park nearby, and so we coordinated with the nanny. I actually went to the park, saw the kid. All the other parents were staring at me, like, "Who is this guy? What is he doing?" Walking up with my doctor bag, getting all my
Yeah, yeah,
stuff
yeah.
out, listening to him, looking at his ears. They're like, "This is what I don't know what this is." And was able to examine the child. Left, called mom. Mom was in a meeting, So she called me after the next meeting, and we were able to go over the plan of care. That mom, the nanny was able to pick up the medications for the child that afternoon, and mom didn't miss work, right? And I didn't
Amazing.
have force them to come to my clinic. I didn't force them to schedule an appointment. It was all very fluid, which is the
Nice.
idea of this practice. We want it to feel effortless, and that's what our parents, pretty much all of them, say.
And I can just imagine you rocking out with your doctor's gear, walking through the park. This is probably fantastic marketing for you. You should have
Yeah, I handed out a bunch of
had
business cards.
yeah, you should have had business cards, like some donuts you can hand out. This is get to know Peds MD. This is a perfect opportunity for you.
Exactly,
Um,
exactly.
so looking back, you mentioned to me that, you worked in the startup, and you said to me that January 2025 was the real turning point. Um, there was a layoff that almost forced you to leave.
Mhm.
Can you sort of
Yeah.
walk me through that month?
Yeah, it was a really emotional month. You never expect, especially in a primary care field, to ever get let go, right? That's always hard. Anybody that's been through that, I really empathize with you. But it the first thing I think many people feel, at least I could say what I felt, is just immediate panic. Like, what am I going to do? Right? We have two kids. We uh, should I go back to corporate healthcare, right? Which I had already told myself. I'd started the company as a side gig, a few months prior, and um, didn't feel like it was anywhere close to being like anything real, right? The imposter syndrome that we spoke about
Yeah,
before was 100% still there. I didn't know what this was going to be, and so sat down with my wife, and we really. After a lot of discussion, it certainly was not just a day or two. It was a very involved discussion. Um, Decided, she would go back full time. She's in healthcare as well, and we would try this for like 6 months, and then pull the chute if it didn't work. Because luckily, as a pediatrician, I can get a job most anywhere,
yeah,
and so I always felt like I had that fallback. But having her support during that month was nothing short of incredible. I mean, she is our biggest investor. She's our biggest supporter, and made it possible. And I don't know when we didn't really get to the 6 month point. We didn't have like a debriefing at 6 months. It kind of just we we saw it working, right? I mean, the growth
yeah,
was just like exploding, and I was getting so much interest that the videos that we were posting, my very early videos I was doing myself, were getting a lot of traction with kind of my target demo, and
yeah,
it started to feel more real over time. And certainly once we hit that 100 member number, I mean, at 75, my wife was like, "Yeah, Trey, I think this is like we've got something here." And for me, it was like the 100 number. I was like, "Okay, like I think I
yeah.
think I think we can do this." And so, but January is when we decided to go all in, offer like full primary care, including like all the vaccines and all the support that goes around that. And again, we've kind of built and changed and added new member benefits over time. Tried to be very nimble and responsive to our moms, to our parents, and we haven't looked back.
Yeah, and look, it's fantastic that, you had your wife there to support you. So that having her work in healthcare is a huge benefit.
Mhm.
Helping to well, pushing you in the business when you first made the jump. How much did having her as as a safety net shape the risk that you were taking?
I mean, it definitely helped. I think it would have looked a whole lot different
Yeah,
without her. I mean, we did bootstrap this from the get go, and it would have been much harder to do that. I think just the our financials now, at least our you know capital mix would be much heavier in debt. I think it would have been a lot more challenging trying to offer a new model. If I'm opening a classic concierge practice, there's lots of benchmarks out there on how successful concierge practices can be, and you can get doctor loans to help you kind of start these kind of practices. Certainly, like a traditional practice, which people just aren't doing anymore. But making this new model made it even more of a leap because it wasn't going to be I take this model to a bank and they say, "Oh yeah, this is a well recognized model. We definitely want to support you in this." But so it was instrumental. I mean, we could not have done this really without her. And then the other special mention is my nurse Emily. She's really
yeah,
my partner. She's helped me build this from the beginning, but it would not have been possible without her support too. Just helping take some of the load off of me, helping me kind of organize and build things, sounding board. Absolutely, vital parts of the early part of the organization,
Yeah. And it is all about just believing in yourself and taking that leap.
which is hard.
Yeah, and I think we all suffer from imposter syndrome when we're doing stuff like this. Launching a business by yourself even with some support of others is always the most nervy thing because essentially you're getting rid of that comfort that you know is always there, and that comfort is probably a stable salary, a stable job, a 9 to 5, or whatever it may be. So, what have been your biggest successes along the way so far? Would you say?
I think one of the biggest successes has just been the reception from parents. Just the healthcare is unnecessarily complicated, right? Because of all the middlemen, here at least that exist between like you and your provider, right? And I think what my families really really love is they love like the laid back approach. They loved how just easy it is. Literally, my parents have me in their phone. We communicate through a HIPAA compliant text platform. My parents love just being able to text me like they text a friend, right? But just hey Trey, I'm sure this is fine, but just wanted to check with you. And it takes
Yeah.
very little time for me. Um, so I think it's just been the reception and the positivity around, hey, it's kind of cool. You're doing something, really unique. I mean, some practices do offer house calls, but very rare for practices to do predominantly house calls and make that work. And certainly, the virtual or tech part of it is what makes that possible. But I think it's probably been one of the biggest successes is just the reception that it's gotten here locally and the attention it's getting, at least here in the Southeast, among other cities and other parents messaging me saying, please come to Charleston, please come to Raleigh.
So you've had other families in reaching out in other areas.
Yeah, we have. All our social media has grown significantly.
What
Um,
what has been your primary social channels at the moment?
Instagram for sure. 80% of our business is coming through Instagram right now, about 20% word of mouth, an increasing percentage from TikTok, but it's definitely, we've definitely invested heavily in Instagram because our target demographic is like millennial moms and very, very active on Instagram more than any other platform.
Yeah, of course. And look, I was having to think about this before, and it's so many doctors are made to feel that it's impossible to leave corporate medicine
Mhm.
and branch out and do something like this. What would you say to, say, a doctor listening who kind of feels stuck?
I think there's many ways they make you feel stuck. I think we talked about the comfort of a stable salary, a 9 to 5, not having to worry about the business side of things, right? But I, I think what any founder would say is or I think a lot of the barrier. I think probably the biggest barrier for doctors is to doing something like this, to moving independent. Aside from the 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 non-competes, the other things that exist, the comfort, I think is just wanting to have everything planned out, every single piece of like every little thing, every little procedure that happens in a clinic to all be figured out before you just jump in. Right. And I think
Yeah, of course.
for any founder, you have to just like start somewhere and like build as you go. We started out without an office, right? Because that's obviously overhead. We started out with literally just a bag of supplies that probably cost me about $200, right? And it
Yeah.
was very scrappy. Um, oh, you potentially have strep. I need to start ordering strep tests, right? Or I need to order, XYZ to like, do these different things. And, it's not like you have to have everything or drop tons of money to do something like this. Especially in my specialty, certain specialties need a lot of supplies and equipment.
Yeah, of
It's very
course.
different, but I think for primary care, you don't need much, right? Literally 90% of the time, I'm walking to the house with a backpack and it has everything I need in that backpack for that visit. So
So office wise, are you working from home? Is there plans to open somewhere? What's the next step
yeah,
there?
we have an office. It's funny. It's my wife was very nervous about me signing a lease for an office, even though it was we felt like it was a needed move. We had folks who wanted the option of an office. And again, we want to emphasize adaptability. I can come to you if you want to come to
Yeah,
an
of course.
office, that's fine. And then we also have folks outside of our service area who don't want to either pay for a convenience fee for me to drive to them to see them, or I don't service anywhere more than 30 miles around me, and so the only option is to meet me at my office. And I have folks that do that. I feel very flattered, but the office is very small. It's not like a huge medical office. It's not even the biggest expense on our expense table. And so the office is there for flexibility, for nurse visits if Emily's doing a procedure and they want to meet at the office. I'm maybe in the office 1 to 2 times a week, and it's only to meet a family there, and then I'm out. I don't have
Yeah,
like a whole
100%.
clinic day, but mostly work from home. That's that the flexibility piece. Not only obviously the patient benefit, but the provider benefit too, which is something I think about a lot, especially being passionate about mental health for both kids, but also fellow providers, is having that
Yeah.
flexibility to have my schedule, my day start when I can, or when today, like, my kids are off school and I don't have any scheduled appointments. And so it's mostly working from home, which is a great mix.
I think having a young family for you, just the flexibility of it all must be so much more beneficial than the corporate world.
It is. And honestly, I think a lot of doctors are thinking about or talking about, at least my friends, oh, I make so much money for this hospital, and like, this is how much I pay, and it just doesn't seem fair, right? Um, and it's just because there's just so much else in the middle, right, that has to be covered. And then obviously, large health organizations, even nonprofits, are making billions of dollars. Administrators are, everybody's seen the charts in healthcare of how many administrators exist within healthcare. And so all that money is being pulled into other places, and the doctors end up just feeling like, we are providing the care, we are the standard here, but we're not what's most important at the organization.
That makes sense. So looking at the Peds MD today, what are your offers? I know we've spoken about house calls. I think there are membership
Mhm.
tiers. You also have the offer of virtual, and you mentioned last time potentially launching maybe an adult side of
Mhm.
things.
Yeah.
What's the current state of play?
Yeah. Currently, we offer different membership tiers just based on what you're looking for. Again, trying to be flexible, offer options for our families because that's what they want. So we have the main predominant lion's share of our membership is on our primary care plan, which is pretty much everything. I am your kid's pediatrician and dedicated pediatrician, right? You're going to see me if your kid is sick, if your kid is well. The only time you won't see me is if I'm on vacation, and obviously I would let you know. But it's not I call the office for a sick visit. My doctor's of course full because checkups schedule out weeks in
Yeah.
advance, months sometimes. And um, no, you just text me and we figure it out. So you have a dedicated pediatrician. It includes all vaccines. It includes virtual visits. We give our families a telehealth kit. I call it my enhanced telehealth kit that allows us to diagnose or manage a lot of things remotely. Interestingly enough, I've diagnosed an ear infection for a family that was traveling. They were in Portugal. I was able to work with a
Amazing.
local pharmacist who spoke English. I found one. And fortunately, I do not speak Portuguese. And he was able to help arrange getting the antibiotics for the family, to their hotel. So it was actually kind of fun to do that. But so the telehealth kit definitely helps us lean more into the virtual side of things to reduce the over
Yeah,
reliance
nice.
on in-person visits. Um, but then, again, it includes house calls, and much more. So that's our primary membership. Then we have other memberships like sick visit only, which is more focused on having me on like retainer if your child is sick. And then our virtual only membership for those folks who exist outside of 30 miles. Obviously, I'm not going to travel to
Yeah,
their
yeah.
house. So we offer a virtual only option to help reduce their, the need for urgent care visits or even ER visits.
And what I wanted to ask you about is, you deliberately cap the panel and run a wait list. Why build it that way when everyone else is chasing volume?
Yeah, I think it's the resource parents want right now is time, right? It's time
Okay.
with their provider. They want to build a relationship. they want to find doctors who will serve as a partner with them and not just tell them what to do, because it's very quick for me to just tell, hey, here's what you need to do this, right? There's my prescription. Don't argue with me. Here you go. Get out the door, right?
Yeah.
That when you don't have time to spend with families, when you're seeing 30 kids a day, it ends up not being that exactly. Obviously, again, doctors are very empathic, or we like getting to know our families. They're going to spend the first few minutes, or any good doctor should, like catching up, right? Seeing how you're doing. Um, but that's what, essentially, when you boil it down, that's what it is, right? And so parents want time, and you can't chase growth at the expense of quality, right? We want to maintain we're offering a very premium, high quality product, and therefore we need to be very intentional about our growth. We need to make sure we're bringing on people who are going to also have that ethos, have that mindset, um, because quality, when it comes to everything that we offer, quality is the number one thing, and what that looks like for patients is with time and that relationship piece.
But what makes me think about that quality and that sort of value piece is, if you were just saying this is your prescribed medicine, there you go, there's the door. From your side of things, you now have the ability to do proper diagnosis, proper discovery, which makes me think that how often someone will walk through your door with a problem, and the problem they're actually facing it isn't actually that problem, it's potentially something else. That's something you come up against now that you've come from 15-minute windows to be able to having a better relationship with someone.
Absolutely. Yeah. How people interact with the healthcare system now is almost like the wave, right? The parents have to decide when they want to see or touch the healthcare system, whatever it may be. They see their pediatrician, they see their general practitioner, and they see a specialist, right? They interact with the healthcare system. The healthcare system
Yeah.
responds to whatever's going on at that time. But in between these like touch points with healthcare, there are lots of other things that go on. And I think, even now when I refer folks to specialists, I still see and feel when I read the note that the issue at hand is being approached in a very isolated way. So here's a nail, here's a hammer, let's fix it. Um, Whereas when you have this more longitudinal view, when you have somebody who is seeing your kid for both well checks and sick visits, and well checks and sick visits, and kind of knows what's going on in between, and is not having to go to urgent cares or ERs, which we're happy to talk about how effective this model is at reducing those. But what you can do is start being a lot more curious, right? Like why I'm enjoying this so much is that I have more time to be curious,
Yeah.
to like sit and think through a case, like try to put all the pieces together, like a detective almost, which is pretty
Yeah.
fun, and come up with ideas, right? And talk to my families, bounce ideas off of them. Obviously, evidence-based medicine, clearly, but you just get a better, more holistic picture of what's going on, and it can just increase the accuracy of care, can reduce the reactivity, increase the proactive side of things,
Yeah.
and obviously lead to better outcomes.
You can start suggesting things rather than just being like it's one size sort of fits all.
Hmm.
Um, and the plan is to grow the Peds MD. And right now, families mostly find you. I know there's some great word of mouth out there, or they track you down, fire you a LinkedIn
Yeah.
message. Um, how are you thinking about reaching the ones who don't know you exist yet?
Yeah, I think again, we're being very intentional about growth. I don't want to have people frustrated that they're signing up and can't get off the wait list. So we are bringing on, additional providers. Our
Yeah.
next big push, as you mentioned earlier, is moving into the adult side. It's been interesting. I did not assume, or would not have thought, that pediatrics would have been a good beachhead into the adult side, because a lot of companies focus on adult medicine first. But it's been very surprising, the tie between the two. And so my pediatric families, when I sent out a
Yeah.
text, obviously it cost me $0 to send out a text message to my members. Within 30 minutes, I basically texted saying, "Hey, we want to launch the adult side later this year. Who would be interested?" Right? Obviously, a little more than that, but within 30 minutes, I had 67 people on a wait list. And
Wow.
I mean, obviously, that's not pretend. That's proof of concept, right? And so it just added, fuel to the fire. So yeah, our goal is to kind of finish building out what this Charlotte clinic looks like, right? How this model really works. We're building a lot of foundation under that, um, with the help of like our legal team and other folks, but eventually picking this model up and saying, okay, let's drop it in another market that makes sense, right? And there's a ton of markets here in the Southeast that do make sense for this model. And so we're taking on investors now to obviously grow, continue to grow, and then eventually start scaling this into other cities, and just keep going from there.
And probably take on more physicians then as well.
Yeah, we're definitely we're looking. Our next key hire is a family medicine doctor who can service both. We're going to have them primarily focus on building out the adult side of the practice. We're not marketing ourselves very intentionally as like a family practice office. We want the kids to have their specialist, and we want the adults to have their specialist too. But this family medicine doctor is is kind of our next key hire. It's our first other doctor hire, so we're very excited about
Amazing.
that. But there's plans to maybe have hire nurse practitioners to manage their own panel, right? Not cross cover us, but provide care at their own
It's like
panels.
a franchise model almost.
Yeah. We're trying to maintain clinical control because quality is really important. And I did in consultation with the lawyers to worry about the franchising model being having a little less control over that quality. I don't want, again, folks chasing volume at the expense of a good member experience, because then obviously that tarnishes the brand. But we're looking at it as like opening new clinics in various markets and cities, and all having it streamlined under one name.
This is very exciting. Lots of growth on the cards, new positions, new areas, and I think there's so much untapped potential because there's so many people, one with busy jobs, busy lifestyles, who are relying on their corporate healthcare supplier, not getting what they need, and their child isn't getting the attention they need. And I think it's a fantastic gap in the market.
Yeah.
So looking at the future, so you're building, we've just spoken about, you're building towards own clinics, the Southeast, Charleston, the Triangle. What does scale done right look like in the next 3 to 5 years for you?
I think what it looks like to me is, 3 to 4 providers in each market, with, again, limited panels. At least a core group of 3 to 4 providers in a market, with those limited panels that I mentioned, and just creating like ecosystems in each of those cities as far as like other specialists, other ancillary services, PT, OT, speech, even like sleep consultants, all just working together to create just a very proactive model of care for families in these various cities. I think for me, hitting a 1,000 member mark total is a huge milestone. I think in 3 to 5 years we could get up to even 5,000 kids, if not even more. And so the success for me would just be having other folks in other cities really adopting this model, understanding how traditional healthcare is just way too reactive and, again, relies excessively on urgent care ER visits, and having those people not in those places, right? Having them stay at home and just continue to evangelize, the model that we're pushing.
Okay. I think something we didn't also touch on was the sort of the employer channel in play as well.
Yeah.
How are you going to sort of balance the employer channel, the new adult line, with what you're already offering the children's pediatrics? How does this come into play then?
Yeah, it goes back to thoughtful growth, right? What I don't want is to sign with a Fortune 500 company and have to take on, 1,000 all of a sudden 1,000 members who, we can't onboard efficiently. We don't have the systems to onboard efficiently, to maintain that quality, right? Because even in the B2B world, which is definitely a big push for us later this year, is maintaining that quality, maintaining that access. I think the model will look a bit different with employers.
Yeah.
It might end up being more pooled, depending on which service they sign up for. But at its core, we just want to make sure we're maintaining that excellent quality. We want to make sure we're providing good data to these employers. I think that's really important. The model can be very effective in that story I gave you about reducing employee absenteeism, right? Mom was obviously still at work, obviously still worried about her child, but knew that her kid's pediatrician was going to the park to see them. It provides her a lot of relief in that moment where she's stressed and doesn't know what to do, and is probably thinking after work, I'm going to have to take him to an urgent care, right? Well, that wasn't the case, right? The doctor went to him, and so the being thoughtful again about partnering with, at first small businesses and getting their feedback. We want feedback. It's very important to us. I
To
don't
improve to, yeah.
exactly. I don't know everything, and I want to make sure what we're offering makes sense to these companies. But I think just being thoughtful is probably the biggest thing.
I, I was just about to say that. Like, two of my favorite things from today's conversation is how thoughtful you've been with every single part of your growth in terms of your next steps and how you're looking to expand. And then the other most important thing, well, favorite part that you've mentioned, the quality.
Mhm.
It's like it's all coming down to quality. The whole reason you launched this is to provide quality care, and it sounds like you won't put a next step forward if you know that quality could be potentially be tarnished.
100%.
Um,
100%. Yeah, that's what families want, and that's why we put so much work into this. Is in 2025, for example, I had 2 children that went to an ER, 0 kids went to an urgent care, right? And those 2 kids that went to the ER, they were very sick. I tell parents I can't handle everything, right? I'm not a surgeon, not an ER doc. I don't do IV fluids, right? There's just certain things I can't do. But in my experience, especially my experience and background in telehealth and virtual care, about 80% of the time, a child is sitting in a waiting room in a pediatrician's office or in an urgent care, in many cases, the ER. They didn't need to be there. And a lot of parents are starting to understand that's true, right? And they're willing to pay to not have to go in and sit in a waiting room for 30, 45 minutes, not see their doctor that knows them, see some random provider and get some canned answer about what it is or what it isn't, and not have a discussion on what alternatives could be. And so
it's
people are wising up.
it's pulling the parent away from their job where they're potentially losing any money
Hmm.
themselves, which they could be putting into something like the Peds MD when they're getting the care brought to them essentially.
Hmm.
This is my final question, and it kind of leads into as I said, I wrote down here that your North Star metric is probably keeping kids out of urgent care and urgent cares and ERs. And what does that success actually feel like for you?
It feels really good. And, when you normalize kind of our membership volume last year from beginning of the year to end of year, and you use a common insurance metric as per 1,000 member months, right? It's like a denominator. A really good commercial healthcare plan maybe gets like, 150, right? 150 ER urgent care visits per 1,000 member months. And if we normalize our data from last year, it was 4.4. And so to me, that says we're doing something really right. And again, it's really that proactive care that we offer our families. When any of our kids are sick, we're following. We put them on our get better list, is what we call it. Used to be our sick list, but that's kind of negative energy. So we wanted positive energy for our families. And so if they get on our get better list, we're checking in with them daily to see how their kid's doing, so
Yeah,
we can actually have conversations during business hours, so we can avoid the 10 p.m. panic. My kid looks like crap phone call, because kids always look sicker in the night, right? But anyways,
yeah,
the that proactivity is what I'm most proud of.
amazing. And I look, Trey, this has been a brilliant conversation. I'm going to, particularly for all my listeners in the southeast, in Charlotte. I know I've got some listeners and people I've spoken with previously in the Raleigh area. I'm going to include a link to the Peds MD down below in the podcast summary. But Trey, thank you so much for coming on and sharing your mission and where you've got to today.
Yeah, thanks, Harry. It was a blast. I appreciate it.
Yeah, I appreciate you coming on. Trey, lovely to see you.
Yeah, you too, man. Take care.
Cheers. Bye bye.